Hello, Chicago. I am Dr. Simba Ige, the Commissioner for the Chicago Department of Public Health, and I am back again with my colleagues to talk about our measles outbreak and response, and I have here with me Dr. Funk. Dr. Funk? And Dr. Sloboda is here again with me. These are two of our medical directors that have been actively involved in this measles outbreak and response. So we are using the term outbreak deliberately and measles. So in case you missed it, we have had a measles outbreak. But what is measles? And how do we recognize it? So measles is a highly contagious, serious, airborne disease caused by a virus. So it is a viral disease, and it is transmitted through coughing, sneezing, and then it can become airborne and linger in the air for a few hours, about 2 hours. And the symptoms that you should pay attention to is number one, high fever. The rash is very characteristic of measles, and we have put in here 2 photos of what the rash can look like depending on the color of your skin. It is a fine rash, and it starts from the face and then progresses to the rest of the body. And usually there's also cough, and there's also a runny nose, and then the red eyes. So this combination of symptoms makes one suspicious of measles. It still requires some diagnostic and testing processes, but if you have this combination of symptoms, you should call a provider. One of the questions we get all the time is, what if I have a rash with no fever? Dr. Fong, do you want to say something about that? Should I be worried?
Sure. So, as Dr. Ige has mentioned, the fever is very characteristic of this particular disease. If you have a rash but no fever, it's still a good idea to visit your healthcare provider, but measles is very unlikely. When we start to really worry about measles, we want to make sure that the person has a rash and a fever together to really increase that suspicion.
Thank you. So, we said outbreak. We use the term outbreak when there is one of 2 things. When we see unusual patterns of an illness or unusual numbers of a disease. We are saying we have a measles outbreak because we are seeing numbers of measles cases that is unusual. We have had 0 cases for a couple of years, and now we are beginning to see high numbers. So, Dr. Sloboda, what is the current status of the number of cases that we have seen to date?
So as of this morning, there have been 15 cases of measles in the city of Chicago.
And what is sort of like the age distribution of the cases that we've seen to date?
Sure. So you can see here, measles mainly impacts the younger ones. So 0 to 4 is where we're seeing a majority of our cases. But if people may not be vaccinated, they can still get it into adolescence, teenage years, and even in their 20s, 30s, and 40s as well.
Right. So this is really important. Anyone can get measles. Most common in children, but as you can see here in Chicago, we have adults also that are contracting the disease. One of the things to note is, when am I infectious? If I have measles, what precautions should I take? What is that infective period? And Dr. Sloboda, I will pass this on to you again. What should people know in terms of infective period?
Of course. So it all has to do with the rash and 4 and 4. So we always, whenever we're looking into a case of possible measles, we always want to know when the rash started. And so like Dr. Ige says, it starts around like your hairline and then kind of drops down through your face and into your neck, torso, and down your body. But we really want to pinpoint down the exact time when they first noticed the rash, because that will give us, because measles is pretty predictable, and so we'll know 4 days before that started and 4 days after is the contagious period, and then that's where we can kind of go from there to figure out if there's other people that are exposed, because like we said, measles is very contagious, and so we want to kind of track down everybody that may have been exposed and make sure that they're safe and vaccinated.
Thank you, Dr. Sloboda. So one thing that is important to note here is we look out for the rash, but note here that infective period precedes the rash. So people can be infectious even before we know that it is measles. And this is why we have really depended on vaccination as the mainstay of protection. Because many times by the time we get notified that there is measles, the individual has already been contagious and probably won't know that they have measles. And so this is one of the reasons why preparing for an outbreak is so important. So I will talk a little about our public health infrastructure for detecting diseases, identifying an outbreak, and then responding to the outbreak. So the Public Health Department is really responsible for disease control. And that requires an infrastructure for us to do disease surveillance and notification. That means we track many, many different diseases, 70 different diseases, that is 70 diseases that are reportable. And some of them have to be reported immediately within 3 hours of a provider making that diagnosis. And we have a robust surveillance system that is tracking all of these diseases, including in international context. So I get a notification if measles is detected in Brazil or measles is detected in France. And that way we can prepare, because this is an international city. We receive visitors from all over the world. So that robust disease surveillance and notification is part of our disease control infrastructure. And then testing and diagnostics. So for instance, with measles cases, the Department of Health has to sign off on every testing request. So let's say you go to a hospital and there's a suspicion of measles. The hospital reaches out to the Department of Health and we say, yes, you can go ahead and do the testing. If the tests come back and it is positive, then we are notified like there is a measles case, and then we launch into action, including case investigation, contact tracing, where have you been? And right now we have a website and a dashboard on our website for the measles cases, where you can see the different places that we have identified, schools, community exposure, so people know where they might have come into contact with a potential measles case. And a part of our work is also quarantining and isolation. So for those that have been exposed to measles and are not vaccinated, we ask for them to stay away, stay at home, stay in place for 21 days, which is how long it takes to develop measles. And for those who have been sick with measles, like Dr. Sloboda described, they should be in isolation until 4 days after the rash has developed. And then part of our response is also identifying those who are most at risk of infection and taking precautions, particularly vaccination and other infection prevention measures. So Dr. Funk here, in congregate settings where people are in large groups, she is responsible for ensuring that those congregate settings are safe and there are infection prevention protocols in place in those settings. And a huge part of our work is the community engagement, which is why we're here today, making sure Chicagoans have information on how to protect themselves, how to identify measles, what precautions they should take if they're at risk, etc. So we are going to dive a little deeper into the vaccine operations for this particular outbreak. We started by saying we have had 15 cases to date, some in adults, some in children. And we have been working really hard to identify who is at risk and then making sure they're protected. So Dr. Sloboda, tell us a little about the vaccine operations that we have mounted up to date, how quickly that has been, what kind of support and resources we have needed to get shots in arms.
Of course. So last week we talked about the vaccination operations that occurred at the first shelter where there was an exposure of a measles case, and we worked very quickly and safely with all of our partners to make sure those people got protected, got the MMR vaccination to protect them from developing measles in the future. And so we did around 900 vaccines at that time. But since then, we've continued those operations throughout the city and throughout many of the new arrival shelters to prevent any further outbreaks at different settings. So this is just a couple days ago, but we've already done over 3,000 MMR vaccines that prevent measles in those settings. And we couldn't do it without all of our partners from different healthcare settings, different offices and departments within the city, community-based organizations. We have a lot of volunteers as well that have helped us reach these numbers to keep people safe. Because, like we've said many times, the vaccine is very, very effective, very safe, and is our best tool in keeping people safe and preventing any further cases.
I just want to say a big shout out to our partners and to the CDPH team that have been working nonstop. This was unprecedented. Within 3 days, we were able to get to every single eligible person that required a vaccine and get them vaccinated, with almost no refusals. And they're repeating the same remarkable feat in some of the other new arrival shelters, working 16-hour shift, working with community educators, doing one-on-one engagement, going from bed to bed, helping people understand measles and why this is important. And this is why we have had this remarkable success with over 3,000 doses of MMR administered to date. So I just want to say thank you to you and your team for the non-stop work over the last few days. So vaccination is the mainstay of measles control. So how did we get here, Dr. Funk? Why are we seeing a measles outbreak after so long? And we have here some data. Will you talk us through it?
Sure. So as reflected in last week's Facebook Live, there is a national outbreak currently of measles that has hit over 17 jurisdictions in the United States. Chicago just happens to be one of them. In addition, children born in more recent years are having a decrease in vaccine coverage in comparison with those from the early 2010 levels. So you can see, in 2011 and 2012, we had about first 88% and the 82% coverage, and we saw an increase to about mid-90% coverage from 2015 to 2016. And now we're back down to about 85% coverage. And so increasing that coverage is really important because, as Dr. Sloboda has mentioned, this population is really at the highest risk for contracting measles.
Yes, so it gives us great concern as public health specialists to see these drops in vaccination coverage. Vaccine preventable diseases can be prevented by vaccines, and there is nothing more concerning to me as a preventionist. My specialty is preventive medicine, to see things that can be prevented now actually occurring. So measles can be prevented. We have actually gone to 0 cases for many years, and now the cases are popping up again because we have lower vaccination coverage. So people don't like vaccines anymore, and we really want to repair that and help people feel confident in vaccines again. But the drop we saw in cases, Dr. Funk, is not just in the younger children. We're seeing the same in older children, right?
Yeah, and so this is especially challenging as measles really likes to target those people who are not vaccinated. And unfortunately, older children have overall higher coverage than, while they have overall higher coverage than younger children, there's still similar decreases in vaccine coverage amongst these groups. So you can see 2011, 2012, we had coverage over 90%, and that has dropped as of 2020. And so that's increasing the vulnerable population in Chicago.
Yes. So the measles vaccine, the first dose is supposed to be administered between 12 months and 15 months. And then the second dose between the age of 4 and the age of 6, just before, grade 1. And these are the opportunities for kids to be protected before they go into school and become exposed to hundreds of other children. And this is why it is concerning for us that more and more children born in recent years are missing that opportunity to get that wraparound protection before they are launched into the school setting. So the school community is a huge priority population for us in the city of Chicago. And Dr. Funk, you work with the schools also. We are seeing also a similar trend there with less coverage there. So do you want to say a little more again? What is the threshold and what numbers are we aiming for?
Sure. So we would love to have a threshold of about 95% coverage for vaccination. Again, while relatively high, measles coverage amongst Chicago students has been below 95% for the past 2 years. And I just want to direct you for further information to the website from the Illinois State Board of Education. Again, this is where we can see vaccine coverage for Chicago and other Illinois students.
Right. So we want to get back to over 95%. And this is why we need all hands on deck. And I know that Chicago Public School has been working nonstop to ensure that vaccination opportunities are available for their students. There are all kinds of activities in the work, even for the spring break. Between March 25th and 28th, we're collaborating with them to ensure the vaccines are available. For MMR also, so that anyone who's not vaccinated can be vaccinated and develop immunity to measles. So there can be vaccine appointments made through the Chicago Public School website for elementary, high school, and even charter schools. There are mobile clinics around, and school-based health center can also help with scheduling vaccines. So there are a number of opportunities available for getting school-age children vaccinated. I also want to uplift all the efforts that Chicago Public Schools have put in to increase vaccination coverage, over 700 vaccination events since the middle of 2023. Vaccination events in collaboration with CDPH, over 1,000 doses of MMR vaccines have been administered. 31 school-based health centers, 15 centers are open to the community. So this is not just for Chicago Public School students. If there are other children who don't even attend the school or community members, they can also take advantage of these vaccination events. And there are several locations all over the city, over 130 different school locations where there are mobile services and vaccination opportunities available. So we want folks to know there are many, many different opportunities to get vaccinated. In addition to pharmacies, in addition to the CDPH clinics, we also have all of these opportunities at CPS. We want to bring it even closer to home. And vaccination coverage in the city of Chicago. There are zip codes with vaccination coverage as low as 16%, even for adolescents. So we just want people to understand that this is a citywide effort. It is going to require collaboration with all partners. And this data is based on some of the patients that have been seen at healthcare centers. When you ask about vaccination status, in some instances, only 30% of those patients have been vaccinated across different zip codes across the city. And there are zip codes that have very low vaccination coverage that we want to, again, encourage families, parents, everyone, including adolescents, to please check their vaccination status and get vaccinated. So, Dr. Sloboda, I am going to turn to you again. How can Chicagoans protect themselves from measles?
Of course. Thanks, Dr. Ige. So, yes, like we've said before, the vaccine is the best way to prevent getting infection from measles. It's very, very effective, very safe. So thankfully, in this outbreak response, we have an amazing tool to help protect people and get this situation under control with this vaccine.
Right. And And what if I have been vaccinated as a child? When I was 1 year old, I got vaccinated, and now I don't know how to get that record. What would you advise?
Sure. So thankfully in the state of Illinois, there is a database where you can go and look up your vaccine records if you received them in Illinois. Some other common places, if you went to elementary, middle school in the United States, you can usually call up your the school that you went to, and they might be able to provide you, as well as whatever pediatric office that you went to growing up. Also, many times, depending what settings you're working on, your employer might require you to give your vaccination records, or they might do some blood tests to check your immunity called titers that would also prove that you received the vaccine and that you're immune. So those are several of the different options that people can use to try to find their immunity or vaccine records.
Thank you, Dr. Sloboda. Now, there are some people that cannot get vaccinated. Pregnant people and children under 1. What would you advise for such individuals?
Sure. So first of all, it's really important that those who are close family members with someone who's pregnant or someone who's under the age of 1, make sure that they are personally up to date on their vaccine. What we want to do is to create a round of protection around the vulnerable person. As well, if you know that you are pregnant or you have someone in your household who is 1 year of age or under, and they haven't been eligible yet to get their vaccine, make sure that you reach out to your healthcare provider immediately. This is something that, depending on the timing, there could be some potential availability for other administration of medications to protect you, but most importantly, contact your healthcare provider. And of course, once your child is 1, then they should be visiting their pediatrician to make sure that they're getting vaccinated when they can.
Thank you, Dr. Funk. So we have new arrival shelters. There's some pregnant people in there and children under 1. What have we done to protect them?
Sure. So similar to what I've mentioned, we actually did aim to vaccinate those that are eligible to be vaccinated surrounding this group. In addition, we have been working with other partners to have a separate quarantine space, so a separate space that is not on site at the shelter to house people within their individual family units. The goal here is really to keep little families separate from the larger congregate space as a way to keep them from getting continuous exposure, which is expected given that there was a case and because of how infectious this particular disease is.
Yes. I'm going to ask you one more question, which is about schools.
Sure.
So if there was an exposure in a school, let's say, and in that school there are some children that are not vaccinated, what kind of guidance would we provide in such a setting?
Sure. So within the school setting, if there is someone who is identified as a case, meaning someone who is actually sick, first we would try to find out if they were in the school during the time when they could spread measles. And once we identify that, we would have to identify everyone within the school who was in the school at the same time as that person who was sick. And from that subset of people who were in the school, we would want to identify who of those people has not received a vaccine previously for measles. And that group of people, unfortunately, would have to be excluded from school for 21 days if they did not have a previous history of vaccination. There are some exceptions. If somebody is able to get a vaccine within 72 hours of their exposure, then they are considered to be protected. But for the most part, really, if somebody hasn't had a previous vaccine, they would need to stay out of school. And the reason for this is really because measles is, again, so infectious, and because someone can start transmitting it before they have that rash, which is that time frame that people really are able to identify that there is measles. We want to make sure to protect those that are vulnerable and prevent further spread within that community.
Thank you, Dr. Funk. So because we really want you to fall in love with vaccines again, we have, again, on our screen, MMR vaccine. Just in case you are wondering, where can I get this MMR vaccines? We have some locations around that you can get vaccines for free. We have pharmacies. There's several events at schools. Vaccines are good. Vaccines are safe. MMR vaccine is really effective and can help us get back to 0 cases. And one additional benefit of vaccines, like Dr. Funk has said, it prevents kids from missing school. If there is a kid now who's not vaccinated and gets exposed to measles, they will have to miss school for 3 weeks. So we don't want that to happen. And one more reason why vaccines are good is if you are going on spring break or you are traveling abroad with your kid, what is the recommendations for vaccination?
So for the general population, the normal doses for the MMR vaccine that prevents measles is to get the first dose at 12 to 15 months, and then you would get your second dose 4 to 6 years. There are some different changes, though, if you are traveling internationally. So if a family with a young child is traveling internationally, they can also get an early dose, 6 to 12 months, for some extra protection, but that protection would not last, so they would still need the normal doses. But this is just for international travel. So if your family is planning to travel internationally, you should go see your healthcare provider and figure out a plan to get your family properly vaccinated with MMR and other vaccines to prevent measles.
Thank you, Dr. Funk. Thank you, Dr. Sloboda. The takeaway message from our conversation today is how fantastic vaccines are. In 2019, we had 0 cases of measles, 2020, 0, 2021, 0, 2022, 0, 2023, and now we have 15 cases in 2024. And that coincides with the drop in vaccination coverage. So our goal is to get our city back to full protection at 95% vaccination coverage or more. And we want to reassure you vaccines are safe. The MMR vaccine is safe. It is a very useful tool to keep infectious diseases like measles at bay. So thank you again for spending some time with us, and we will take some questions now. All right, so we see a couple of questions for our medical directors here. Stacy on Facebook says, how are you tracking who is exposed in the shelter, and when will the vaccinated individuals be immune? Dr. Sloboda, do you want to take that?
Sure. So the vaccinated individuals would be immune at about 21 days. Usually we say about 21 days is when the vaccine has time to kick in, and then they should have the protection from that dose that they received. All of our staff, and particularly our epidemiologists at Chicago Department of Public Health, are working very hard, many hours, in tracking people who may have been exposed, whether that be in the shelter and community, to follow up with those people, evaluate those people, make sure they're safe, and then go from there.
Yes, so we've talked a lot about vaccines, and there's a question from Andy on Twitter. Why have we seen a decrease in MMR vaccination over the past few years?
So I think this is a challenging question, and I think it's one that probably requires a little bit more evaluation, but some of the hypotheses include that people may have delayed going to visits for their healthcare provider during COVID. as one potential possibility. Another one is just overall vaccine hesitancy. Again, there are many pockets of the United States in which people have declined to get vaccines for various reasons. Perhaps they don't have enough or the appropriate information about how effective the vaccines are. And quite frankly, as Dr. Ige has mentioned, we've had several years in a row in which we haven't had to experience any of these diseases. And so I think now that we're starting to see this resurgence, the need for a vaccine is becoming more apparent, and hopefully that's carrying over to the general public.
Yes, and I think it's important to always demonstrate the impact that vaccines provide. Sometimes when we don't see diseases, we forget that they're there. And that's because we have high vaccination levels. And if we let down our guard, these diseases pop up. I haven't seen measles, in so many states, in so many all at once in the United States for a long, long time. And we were very close to eliminating measles in the United States. We didn't have cases at all. And our hope is that we can get back there by renewing interest and acceptance of vaccines. So Dave on Facebook says, how should people who are not able to get vaccinated protect themselves? Dr. Fung gave some tips. One is to make sure those who are around them are vaccinated. If you are surrounded by vaccinated people, they will not get sick with measles, and therefore you will not be exposed. And so that is the primary way to protect those who are not vaccinated or able to get vaccinated. And if they should become exposed, to immediately contact their providers so that they can give them appropriate guidance. Are we providing migrants with other vaccines? Are we testing and vaccinating for COVID? So I will start with the first part of that question. Are we providing migrants with other vaccines?
Yeah, so for a while now, we have been doing a lot of vaccinations for new arrivals, migrants, particularly this past winter season for flu and COVID. We did many mobile events at the shelters to do those vaccines. We also, there were some cases of chickenpox, varicella, so we did a lot of that vaccine on site at the shelters, but we've also been working to make sure that the new arrivals, migrants, can get to doctor's appointments and clinics so that they can have their vaccine records and vaccine history evaluated to see which ones they might be missing, to get them caught up on more routine childhood or adult vaccinations such as MMR.
Right. So this question also says, are we testing and vaccinating for COVID? So testing for COVID is symptom-based. If you have symptoms suggestive of a respiratory virus, then you get tested to determine which of the many respiratory viruses it is, including COVID. And vaccination for COVID has been ongoing since September. At least once a week, there is a vaccination event at all the shelters. So yes, testing and vaccinating for COVID is happening. Sarah on Facebook, how did measles get to Chicago? Is it from international travel? Do you want to talk about that?
Sure, that's a very good question. So many of you may have heard in the media that there have been sporadic cases, as I've mentioned, in other jurisdictions. We've recently heard of cases kind of in and around Chicago. As the asker has asked, it is very common for diseases to come from people who are traveling internationally and maybe are not up to date on their vaccinations, and then bringing them into the city or into other parts of the United States. And it's important to note that whenever we find pockets of, or whenever measles finds pockets of people who are vulnerable, there's the potential for many people to get sick all at once, and as a result, then it can spread into larger spaces. And that's part of the reason that we're being so aggressive in our response here.
Right. So in the particular outbreak that we have not been able to tie it to international travel. The first case of measles in the city of Chicago that was reported to us on the 7th of March there was no direct link to international travel. So and in the new arrival shelter, that this did not come with those who were newly arrived in the city either. So this means that measles is circulating in our city, and it's why we are putting the call out for everyone who is at risk to protect themselves now. Eric on Twitter says, how is CDC supporting the health department in this response? Dr. Sloboda? Yes.
Sure. Sure. So part of that actually goes back to the other question. So particularly when there's multiple outbreaks of measles across the United States, that's where the CDC can help in connecting those cases, whether they happen in another state and travel to another state and into Chicago. So that's where they can help us link up how measles was spreading. They also, when this CDC helps out, they also have people that's like their job is measles. They work on measles all the time. They have a lot of experience with measles outbreaks, and so it's really helpful to get their expertise because they've had been involved in similar situations, whether in the U.S. or in other countries. So they just help support us in our planning, in our operations, to make sure we are doing everything we can.
Right. So we're very grateful to the support from the CDC team. They have been with us for about a week now. Their epidemiologists and their medical team supporting us in CDPH with this response. So Hannah on Facebook says, do masks help protect people against measles?
That's a very good question. So they don't measles is not as well protected from masking as we think about COVID and all of the need and use of masks. The thing about measles is that it's spread through the air, whereas with COVID, which we're more familiar with, there's more of a droplet transmission. And so with the mask, it really needs to be a very close-fitting mask to be protective. Really more effective is the vaccination and making sure that, not only have you received your first vaccination, but also if you have not received your second vaccination and it's past the first month after you've received your first, that you're really making sure that you've had those 2 doses. And that's really the most important tool that we have.
Thank you, Dr. Funk. Jenny on Facebook says, how can the community support vaccination efforts being done in the shelter? We have had robust collaboration with many of our healthcare partners who have been vaccinators, and we have also had support from some of our community-based partners with the health education. Again, because we're dealing with an outbreak situation right now, so we are teams that have been trained and assign different roles so that we can limit exposures to people. So we are putting out calls for our Medical Reserve Corps and also community health workers as we roll out the operation. So if there are folks who are able to volunteer for the Medical Reserve Corps, we have a link for that to happen so that we can, roll out and rotate our teams when needed. Bob on Facebook says, how long will it take to vaccinate all the shelters? It's going to take some time. Dr. Sloboda can say a little more about the hard work here is convincing people to take the vaccines. The operations itself, you can very easily vaccinate 1,000 people in a day, but because this is preceded by one-on-one engagement, helping people understand why this is important, it is a lot of work. So it's hard to say when, but do you want to say more?
Sure. So yeah, like Dr. Ige say, there's a lot of shelters where there is no known exposure to measles, and so people are just going about their daily lives. Everybody in the shelters are working, going to school, taking care of people. So what we've been trying to do is create different strategies and operations to catch people while they're at home, during meals, or early in the morning. But yeah, we've kind of taken a targeted approach of shelters or places that may have had some potential exposure to measles, but we'll continue to work with the shelters, the new arrivals, all of our healthcare partners to work on getting everybody the opportunity to get vaccinated with MMR to protect them from measles.
Right. And in addition to that, making sure there are vaccinations at the landing zone. So as people arrive, before they're placed into shelters, they are provided vaccines, and there has not been refusals there. So everyone arriving through the landing zone is getting vaccinated before they get placed in the shelters. And for the shelters, we're modifying based on the shelter. There are some places where our vaccines our vaccination clinics are in the afternoon, and some places where it's in the morning, and sometimes when it's during the weekend when the kids are back from school. So we are tailoring the approach based on the shelter to provide people the best opportunity to engage. And again, it's the one-on-one, bed-by-bed, individual engagement that is really key to the success that we've had to date. And I think those are all the questions that we have. Thank you again for your interest in the work. And this is a all of Chicago response. So if you have friends, if you have family, loved ones that are yet to be vaccinated, please help share this information. There are pharmacies, there are school events, there are CDPH clinics, your provider. MMR is available everywhere. Please get your vaccinations now. We want to get our city back to 0 measles cases, and we can do it. Thank you, everyone, and stay safe.
Thank you.